Thank you very much, everybody, for your rejoining this session. This is a very important session today. As you know, for the last 10 years, we have been working with the WHO and talking about improving patient safety in Africa. And the WHO Africa office has really been helpful, and they've really worked with us. And we all collectively thought we would like to take this issue higher and together with other regions. And thankfully, after 10 years, the World Health Assembly and the WHO's executive board accepted the proposition put to them that Africa and the rest of the world needs a global patient safety action plan because our healthcare systems had become very unsafe. I don't know whether it was the pandemic or what something did click in there. There was resonance that we do need to bring in patient safety into the center of healthcare. And everybody has a right to quality and safe healthcare. For this session, I'm very proud to say that we've got some very good speakers lined up. To start off with, our moderator for this session will be Ellos Lodzeni, a board member and treasurer. Ellos is a patient safety champion in Africa and has with his work, and I think Dr. Titus comes with a great recommendation from many sectors, especially since this year is the World Patient Safety Day is all about marking maternal and newborn safety. And we looked at Dr. Titus's great presentation on how fake drugs had intervened within the maternity healthcare and antenatal side of things and resulted in horrific hysterectomies and ruptured wombs because of lack of quality safe drugs in our system. And he will progress through and explain why it's needed. And Dr. Gertrude's home from Zimbabwe, I think, as you know, has been in the front line of bringing in new changes, and it has been very important to bring that in. And her personal master's in public health from University of Pretoria really gives us good standing on knowing what our systems are. And a nursing background, I think King's College London really seals the approval of that. So we know this great. Now over to you, Ellos, and thank you very much, and let's have a great session. Thank you. Over to you, Ellos.
Thank you very much. Welcome our speakers. You have 10 minutes each to make a presentation. Then after that, we'll have a question and answer sessions for about 20 minutes. This session, as Kawadip has said, the purpose, the objective is to raise awareness on the WHO Global Patient Safety Action Plan for 2021, and also advocate for patients' lead on this plan and ensure that through their engagement and co-creation, we can eliminate all avoidable harm in Africa universal health coverage by 2030. So at this point in time, let me invite Dr. Gertrude Avortri to give us her presentation. Thank you. Over to you, madam.
You take the script of some part is covering my presentation. Okay, thank you very much, colleagues. All protocols observed. This afternoon in Seychelles, I have the opportunity to briefly discuss with you the Global Patient Safety Action Plan. As you are all aware, this is a big document, and to present it in 10 minutes, it means that we really have to summarize it. This is the outline of my presentation. I'll quickly take us through what patient safety is with the new definition that we are working with. We will discuss where we are, and then briefly go through the action plan. And then since this Congress is mainly focusing on patients' engagement and family involvement in service delivery, I'll expand a little bit on that, and then also discuss the action points that all of us, WHO member states and partners, can put in place to make healthcare services safer for us. We all have a good idea about what patient safety is, and often we say that we don't want to do any harm. The framework or the definition that we are currently working with is an organized activity that creates the culture, processes, procedures, behaviors, technologies, and environment in healthcare that consistently and sustainably lowers risk, reduce occurrence of avoidable harm, make errors less likely, and reduce impact of harm if they do occur. So you realize that the definition of patient safety has been broadened to include all the activities that as care providers and as advocates, we need to put in place to make everybody safe. Where are we now regarding the burden of patient safety? Just to give you a little bit of statistics, just a summarized bit. I'm sure most of you have seen these data. As at now, 134 million adverse events are occurring in our world. Most of it unsafe and happening in hospitals, and they are contributing to about 2.6 million deaths. We have 1 in 10 patients that experience adverse events in low and middle income countries. And then we also have a number of people that die from conditions that we can prevent in our healthcare facilities. And so I'll briefly discuss the Global Action Plan. The introduction has been made. It took a long time, more than 10 years, to come up with this plan that is going to guide all of us. It actually states 7 key strategic objectives with actions on each of them for us to amend to our context for implementation. The first strategy is on policies and mechanisms that we can put in place to ensure that there is zero harm to patients. Some may say this is a vision that we may not be able to achieve. However, we know that we can work towards it. And that is what together we are all going to put in place. The second strategy in the framework that has come out now is to build high reliable systems and organizations for patient safety. In doing this, we want to promote transparency, a no-blame environment, good governance, address issues of human factor, and of course, we also want to address patient safety in emergencies, just as we are experiencing in COVID in this era. The third strategy provides details on safety of clinical processes. And in this area, we have mechanisms that we're going to put in place to improve issues like infection prevention and control. We'll be promoting antimicrobial resistance issues. We want to promote safe medical products and also implement patient safety in the primary health care area. The fourth strategy is on patient and family engagement. And the previous session that some of you participated in discussed it in great details. We, as much as possible, want patients and families to be co-developers of our policies and programs. We want them to be part of the learning systems that will be put in place. We want to also assess the perspectives of our patients so that they can be part of the design and organization of the services that we all offer. And many more as we go through our discuss. The fifth strategy is on healthcare worker education and skills development. And you agree with me that this is really important. Our care providers need to be competent in the services that they offer to us. So we'll be doing a lot of education and training. We'll be creating centers of excellence. We'll promote the linking of patient safety achievements to appraisals, and also as much as possible, work to improve safe work environments in our healthcare facilities. The sixth strategy, as you have seen on the screen, is information and research. And in this area, we want evidence to drive the risk reduction and improvements that will be put in place. And in this area, the focus will be on incident reporting and learning, patient safety surveillance, research in the context of our countries, and also the use of digital technology to improve patient safety. The last but not the least strategy is to develop synergies, partnerships, and solidarity, because as healthcare workers, we cannot do this alone. We need to work with others to enhance the quality of services. And in doing that, we'll be sharing our work, research, policy development, and all of that. We'll need to bring everybody on board using the multi-sectorial approach to service delivery. I must indicate that for each of these strategies, the Global Action Plan outlines actions that should be taken by governments, actions to be taken at the health facility level and all other services, actions to be taken by stakeholders and partners, and as well as actions that WHO Secretariat will be actively promoting. The action plan also promotes the centrality of patient safety in almost everything that we do. And that is what this slide is trying to portray. Whether we are developing processes of service delivery, whether we are developing programs, products, or the population at large, the issues that we do at the population level, we have to put patient safety at the center of all of these so that services do not harm anybody that receives it. I'll quickly expand a little bit on the strategy 4, which is on the patient and family engagement. I'm doing so because this seems to be the theme of this Congress. And this strategy outlines 5 sub-strategies that should guide implementation at all the levels of implementation. So the first one is on the co-development of policies, which I've talked about. The second one is on learning from patient experience for safety improvement. The third sub-strategy is about capacity building for patient advocates and for champions, those who champion patient safety. The sub-strategy 4 is on patient safety incident disclosure to victims. We cannot say that if something happens, patients should not know because probably they will take us to court, but we need to institute systems that we can be transparent and then provide the needed information for action. The last sub-strategy on this one is information, education for patients and family. I cannot overemphasize this, and I listened briefly to the previous section, and this was really highlighted as a way of making sure that services are safe. I must also indicate that this strategy is building on a lot of work that WHO has done in the past. And as such now, we have initiatives for patient safety. And this have been running since 2005. The initiative that was instituted is to promote active patient involvement in almost everything that WHO does and in almost everything that service providers do. And we're going to build on this so that we enhance service delivery. Now, let me quickly expand on the actions that we're going to promote to implement the Global Action Plan. I'll start with what the WHO at all the levels, but with emphasis on WHO Regional Office AFRO, intends to put in place, working with all of you. Going forward, we plan to adapt the Global Patient Safety Action Plan to the regional context for implementation. We are doing this because we are of the view that there may be some regional specificities that should reflect in some aspects of the Global Action Plan. And we'll be calling on some of you to help us to delineate these areas for effective implementation. We will also encourage the formation of patient safety and then patient for patient safety networks. And we know that there are some networks already in existence, so we'll be calling on you to see how we can work together collaboratively to enhance the networks that we need to enhance patient safety activities in the region. In doing this, we want to map and foster networks of patient safety agencies that are already in existence, and then we'll promote effective collaboration in the work that we do so that we can together mobilize resources, joint implementation, and then monitor and evaluate together. Going forward, the regional office will also support and provide technical assistance to member states to translate the action plans into their context-specific actions. And as you can see on the screen, it's important that we determine baseline information because currently there is very little that is known regarding the current situation of patient safety in the African region. So we'll be encouraging countries as a first step in the implementation to establish baseline data to guide action. This data will help them to advocate for revitalization of the program. It will help them in the development of policies, strategies, guidelines, and the rest to enhance patient safety. It will also guide the kind of training that should be put in place for both healthcare workers and also patient advocates. The WHO Afro region will also facilitate measures for learning and sharing of experience. And as I said earlier, we working with you will put in place systems to monitor and evaluate the implementation of the action plan at all levels of service delivery. We'll be calling on you in all these areas to support us, knowing that some of you have worked in this area for a very long time. So for member states, it just follows on what the region will be doing. We will encourage them to recognize patient safety as a strategic health priority. In doing that, we'll encourage them to plan for implementation of patient safety, recognize patient safety in their policies, strategies, and institutional frameworks, advocate and commit to the issues of patient safety. They have to identify and work with local private sector and other patient safety organizations in their countries. And we also want to encourage member states to plan and celebrate all the days and the patient safety challenges that have been put in place. I want to emphasize a little bit on this Patient Safety Day. The next one is the 17th of September. And information has already been sent to all the countries regarding some of the activities that they can do to commemorate the day. We encourage you to share your plans, and if possible, also share your technical assistance needs with the WHO country officers so that together we can plan for the celebration of the day to enhance the visibility of patient safety in your countries. And as partners, there's a lot you can do to ensure that services are safe and will reduce harm. Key areas for you to consider are advocacy, engaging with health professionals and other professionals in your countries or the level at which you are working, and then participate in and be more proactive to support and facilitate patient safety programs at national, international, and local levels. On this note, I'll bring my presentation to an end. Thank you very much.
Thank you very much, Dr. Gertrude, for your elaborate presentation. You have touched the very important issues, and you really focused on an issue with regard to patients and family engagement, which we are all looking forward to. The strategies which you have put forward, we are very sure that they will put forward and advance the patient safety agenda. At this juncture, let me request Milevska-Kostova to give us a presentation on Patient Safety Observatory. Please observe the 10 minutes so that we don't enter into other sessions as well. Thank you. Over to you, Neda.
Hello, everyone, and thank you for the opportunity to be part of the first African Patient Congress, an especially important session for me, the patient safety. My name is Neda Milevska-Kostova, and I'm the Vice Chair of the Governing Board of the International Alliance of Patient Organizations, and at the same time, President of IAPO's Patient Safety Observatory. And I will be speaking a little bit about the role of patients and caregivers in the patient safety from our perspective, and why patient safety is such an important topic. For us, this year is a very important year in which the WHO and its member states have endorsed the first Global Patient Safety Action Plan for the next decade. We already heard about that. But what is so important for us as patients and caregivers is that first time, and maybe one of the rare global policies in which the Global Patient Safety Action Plan really treats the patients, caregivers, and the families as equal partners in bringing safer and more affordable care for all. For this reason, IAPO, representing a number of patients across the globe from all the continents, as you already know, we decided to establish last year IAPO Patient Safety Observatory as a single point global platform for gathering and analyzing patients' experience and expertise that would feed into the national, regional, and global policies aimed at improving safety and quality of care for patients by the patients. And why the patient is so important. We all too well know that the good doctor is the one that treats the disease. We've heard this so many times, but the great doctor is the one that treats the person who has the disease. And what does that mean is that the patient really comes into interaction with the healthcare system on a number of occasions, but that is dismal compared to the entire experience that it brings from from living with the disease or the condition, and at the same time bringing their own traditional values, beliefs, habits, and so on and so forth. So in that sense, the patient can be also a great resource for improving the patient safety. And how can that be? Of course, the patient goes through different phases related to their condition. First, maybe the change that they notice, identification of that change, maybe neglect, postponement, trying to live with, going through the uncertainty of multiple visits to the doctors, then the realization of the reality when the diagnosis comes, then treatment, the new round of multiple consultations and decisions, follow up with the adaptation or going back to normal, and so on and so forth. And at many of these occasions, there are a number of activities or actions, interventions taken, or interactions of the patient with the system in which patient safety can become an issue. And a well-educated patient, a patient with an experience, and a patient that is trained to notice, identify, and communicate those potential risks for the safety of the patient is a patient that can really help prevent further patient safety issues or even prevent additional harm where the safety issue has happened. One experience that I think is important to share with you is Paul's experience. This is a story we got from the Voices of Safety campaign that we initiated last year. And Paul actually had just a severe stomach problem that ended up going to the hospital, had a surgery, and ended up with a sepsis and septic shock. And this was a minor issue to the system because it resolved within a number of weeks when Paul was discharged with the sepsis being ticked as a result. But Paul's experience of sepsis continues until today. And even the immediate after the discharge, he was more than 6 months in different stages of recovering at home, phased return to work. 4 years took him until he walked normally, and so on and so forth. And if Paul was able to identify what was happening, if Paul was able to communicate any of the first symptoms that he noticed to alert the system, probably he would have reverted the such an experience of nearly 5 years to going back to his normal life that he lives today. So patients can be part of the solution. And some of those patients, while we use tokenistically to explain some of the situations happening or to illustrate the severity of what is happening in the healthcare systems, those can actually serve in a more structured, in a better way to inform the systems, not on a one-on-one basis, but rather to serve as a standard or to help become part of the system in which errors or any patient safety issues can be avoided, removed, or prevented. And just a couple of lines here without saying too much is the journey that the patient goes through is questioning across the entire spectrum. When a patient safety issue occurs, the patient considers what happened. Is it my fault? Can I live normally after accepting or understanding, deciding whose fault it is? Can I live normally? How would people accept me? How will I accept myself? And this leads usually to fight or flight situation in which many patients would tend to forget and live on, but yet many other patients would decide to become expert patients and to really share their expertise and experience with others to help them live through that same journey with much less damage. So what we are looking into our observatory is to capture the experience of these expert patients that can contribute to capturing the patient experiences globally from those who actually lived through something that and would wish not other people not to live through that. So in essence, what IAPO's Patient for Patient Observatory is trying to do is trying to capture the actual prevalence and incidence of patient safety, that incidents that are rarely captured. We know that there are national governments collecting the official statistics. There are other national bodies reporting on patient safety data, administrative data. Development agencies, sometimes patient organizations or academia are doing sporadic survey-based, collecting survey-based data and so on. But the actual prevalence and the actual qualitative work related to patient safety or the perceptions of people of how a healthcare system is functioning, how safe it is, or how it can be improved is rarely captured. So our Patient for Patient Safety Observatory is really trying to complement all the procedures and all the current activities of data collection and analysis related to patient safety, but from another angle, and definitely involving patients in every step of the way. So how would we be doing this? We would try to capture the patient experiences through the 6 roles that we identified in this process. And as you can see, the first 3 marked in green they are some of the roles that patients at the moment might play in different research fields or in different clinical trials. Let's say they can become a research participant by contributing their biological materials or participate in clinical trials. Sometimes they are asked to provide insights, information or behavioral studies. Sometimes they are asked to be advisors or to be part of the clinical research committee. But what patients are not doing at this very moment, and what our observatory is trying to capture, to train the patients to do and to involve them more and more, is in these latter three roles, and that is to become reviewers of a patient-related content and lay summary of research data, to become co-designers of projects and gathering data and translating research results, and ultimately to become a driving force in which patients collaborate in projects, but also influence policymaking and implementation. We believe that those are some of the key roles that the patients can play, and we believe that the observatory can serve as a new platform to gather the experience from every individual patient, from every single patient, to try and structure it in a most objective way, to have based on a rigorous scientific standards and critical parameters, in order to really assist both the healthcare systems and the governments and other stakeholders in jointly improving the patient safety and preventing the preventable harm that at the moment is taking billions and billions, not only of funds, but also billions or at least millions, if not billions, of healthy life years and producing a lot of disability adjusted life years that actually the patients can live in a normal and healthy lives if those errors were prevented. So just in summary, the patients come to the healthcare system not just with the disease, but with the cultural, traditional values, habits, and beliefs, and their observations and lived experience can be invaluable in preventing harm or complications and in preventing patient safety issues from occurring on a day-to-day basis, and especially in preventing a repetition of the same mistakes that some system or a facility can go through. The society should strive to create systems for and with people, and not systems structured around diseases and facilities. And that is something that we as patient community are striving to do, something that we as patient community, and you can see in this photo how numerous we are. Unfortunately, this year in a virtual Congress, we are not able to have this picture in such a format, but I'm sure that even if we took a photo of this African Congress that we are having today, the number of participants will be even higher, because for us, Africa is yet another region in which we really need to work hard and work together in patient safety, especially because Africa has proven in the past year that it can successfully work on medicines, on establishing medicines agency, on eradicating wild polio, and so on and so forth. So that there is a great potential to improve the healthcare systems in Africa. There is great potential to set up great standards and to really work on safe and affordable healthcare in Africa. And we as patients and as IAPO are ready to stand by to assist in providing safer and affordable care for all, not only in Africa, globally, but to make Africa a better choice for everyone's health. Thank you very much.
Thank you very much, Neda. This is one of the novel initiatives which IAPO introduced in order to ensure that we have a robust, independent information gathering on issues of harm. This will ensure that there's no conflict of interest and that there is comprehensive information obtained with regard to issues of harm. At this juncture, let me request Dr. Titus Beyuo.
Thank you very much for the opportunity to speak at this conference. And I'll be speaking briefly on safe maternal and newborn care in a pandemic, the African experience. And I'll be sharing with us from the care view, from the point of view of a practitioner, what our systems look like. So with that in mind, I would briefly go through. So my presentation will look like this. I'll just give you my viewpoint and objective of my presentation. Engaging the patient in safe healthcare, I'll talk about that briefly. And I will share our experience with pandemics like Ebola and COVID-19 and how patient safety is taken care of under such settings. Unlike previous speakers, I'm not speaking a lot from the policy position, but I'm speaking from a practical position. So you need to view my presentation with this background that I'm speaking as a practitioner, a gynecologist, obstetrician gynecologist with about 10 years or more practice, a patient advocate, a professional grouping leader. I lead part of the national leadership of the Ghana Medical Association, serving on several groups and committees that looks at how our healthcare system runs. And then an academic with interests in and advocate for women's health. So I'll be seeking to raise awareness on the global health, the global patient safety plan, which has been eloquently delivered by my counterpart from the WHO. I'll talk about I'll point out a few safety areas of consideration for our view. So the WHO Global Action Plan 2021 to 2030 actually left the key safety areas as unsafe surgery, which is cesareans, which is really my area of work, safe blood transfusion and oxytocin. I've highlighted that because I'll share some practical experience with that, how the multi-sectorial nature of our work can really influence patient safety. And sometimes this knocks the heads of practitioners and patients at each other when the actual cause is nowhere near the health facility. It may be regulatory failure, it may be other sectorial failures, but it is seen at the facility, and therefore you have the provider on one end and the patient and their relatives on the other end arguing with each other, having legal tussles, when really the actual cause of the problem is outside of the health framework. Maybe something else that is from the other sectors or collaborating sectors. The other areas of focus are listed here. I won't go much into them, but I'll just mention something like injection safety, epidurals, vaccinations, etc., and preeclampsia. These all fall well within my remit, but since this is not my main topic, I would just want to highlight that there are little gaps that can result in unsafe, avoidable, unsafe practices that is happening across the globe, and more so in Africa, where our other collaborating sectors do not appear to be very robust. So I will share my experience with oxytocin, which is one of the issues that we talked about there. And for our audience from Ghana, I'm sure you'll be familiar with this. Somewhere in 2013, the Food and Drugs Authority of Ghana reported that 90% of oxytocin in use in our hospitals were substandard. And by the time this report came, that the FDA did the post-market surveillance and came out with this report, clinicians had had terrible experiences and patients had had terrible experiences with this drug. The question is, what happened? How did it have to take loss of innocent lives, significant morbidities for the information to come up before the regulatory authorities were set up to find out that something like this went wrong? And I'll accountant in a maternity ward, health expert reveals. And this was the executive director of the Christian Health Association of Ghana then reporting that in one of their health facilities, a chartered accountant died from childbirth complications because when they needed this drug most, what they gave was fake, it didn't work, and she bled to death. I had very bitter experiences of a similar thing. Fortunately, ours did not result in death because we're in a major hospital where we could do a lot about this. I was a resident in training in the latter part of this incident of fake oxytocin in our market. And I can recall some instances where we had postpartum hemorrhage. And this is our first line drug when you have a uterus or womb that is not contracting after delivery. We give this in the hope that it contracts to stop bleeding. If that fails, our assumption is that the womb is simply not responding to our medications. And the next level, if you are at a center where surgery can be offered, is to go in and perform some surgical maneuvers like tying vessels, like trying to compress the uterus to prevent bleeding, or removing the womb. And there are instances where we removed people's uteri or wombs simply because we gave loads of oxytocin and it will not work. And then weeks after that, this thing came up into the headline. We made our own pharmacovigilance reports from my hospital, and similar reports came from other hospitals for the FDA to then investigate, for us to find out that this is exactly what was happening. And the question is, for those women who have gone home without a womb, the system has failed them. Their initial thinking is that the doctor has failed them. It is not the competency of the doctor in this instance, but a regulatory failure. How did this drug get into the market? How did it get into the government procurement system? How did it get into the healthcare facility and teaching hospitals for it to be used and for such results to come in? So this is an example of what regulatory failure can do to patient safety. The next I just want to highlight from the point of view of a practitioner again is patient safety in pandemic settings. And I'm using first the COVID-19. Now, you would all recall that countries started issuing instructions, let's lock down, let's restrict movement. Many countries, including mine, passed a law that made the wearing of masks compulsory and mandatory and a crime if you did not wear it. How does this impact patients? And how were patients involved in this? How were vulnerable groups like pregnant women involved in this decision making? Pregnant women are working in places like the banks and other parts, and some are actually healthcare workers who have to work in public places and must mandatorily wear the masks. Most of us know that use of masks is associated with a lot of difficulty in breathing. Pregnancy also is associated with difficulty in breathing, and this is worsened by the use of the masks. Did anybody think about that? Did they have to check the shift load, the number of working hours that pregnant women have to work wearing the masks? Then the issue of misdiagnosis. Pregnant women who had difficulty in breathing, who had cough, who had chest pain, were misdiagnosed as COVID, were put in isolation centers with people potentially who could have COVID. Test results would delay, and by the time results came in that this pregnant woman is found to be negative, they actually now have a risk of contracting COVID from other people in that isolation who have tested positive. And this misdiagnosis was simply because they presented with symptoms which may be normal in pregnancy, but in the pandemic setting looks like COVID. Then we have how were antenatal care provided under this setting, where people are asked to lock down, poor resource settings, poor communication, patient database is poor. We don't know where to reach the patient to deliver drugs to them. So if you have a 2-month lockdown and a woman is supposed to come to the hospital every 2 weeks, how does that woman get their medications? What systems are put in place at the policy level when such decisions are taken, and how are patient concerns raised? And these are things that I just want this conference to think about, so that when patient organizations are invited to the table, they can make a significant input. And perhaps some of us thought that during the COVID time, perhaps is the worst time to get pregnant. Is that the situation? Because every symptom that you present, you could potentially be misdiagnosed as a COVID patient. And then your antenatal care is also limited during this time. I'll cite another example with the Ebola pandemic. Fortunately, my country was spared of the Ebola, but we sent teams to our neighboring countries that had this pandemic to help in the fight. And I was part of the coordinating committee and the national group that was coordinating all of this. Our country served at the coordinating center in the sub-region. And we helped recruit doctors to other neighboring countries to help battle this condition. And the report we received was that some of the patients who died did not die because of Ebola, but they just died simply because they were bleeding. So if you had a bleeding disorder, if you were a pregnant woman miscarrying, if you were a pregnant woman who had developed bleeding from any cause at that time, you'd probably be seen as an Ebola patient. Now, nobody wants to touch you. They will have to call a special team to come in well protected to touch you, by which time, a lot of the time, it is late. And most health services were shattered by this. What happened to vulnerable groups like pregnant women under such a setting? And this is something that patient advocates, patient voices needed to be heard in the post-Ebola era. What has our evaluations look like? Should we ever have another pandemic? And I think what COVID has taught us made us know that we didn't learn much from Ebola, because we issued national directives without really thinking about the concerns of unique groups of people within our population. And I think this is what we should think about. People with hemophilia and other bleeding disorders. Every bleeding was diagnosed as Ebola until proven otherwise. What happens under such a setting? And imagine that it is actually not Ebola. Test results takes time to come, and you are lumped with people who may have it, or put in an isolation ward where there are other people because of our poor resources. Then avoidable harm, in this case, fatal harm, would have been caused to the patient. So way forward, I am going to advocate that the involvement of patients and vulnerable groups be made at all levels, and I'm happy the WHO Afro rep talked about that, at the global level, at the regional level, at the national level, at the facility level. Patients should play central role in the regulatory space. How many patients are represented, or patient groups are represented on the FDA of various countries? That would look at how drugs are licensed, how post-market surveillance is done, how we will pick up these things before they actually affect patients. Increase advocacy for vulnerable groups in routine healthcare services, but even more so during emergencies. Our emergency preparedness must involve patients, and we must plan with all vulnerable groups in mind. Then it is all right for practitioners to meet at conferences to deepen and share knowledge and develop our skills, because that is critical in the 7-point strategy given by the WHO. I think point number 5 talked about healthcare worker. But the truth is that such gatherings cannot address all the needs of patients. And therefore, a conference like this, where patients lead the way and call in practitioners like myself and others to come and speak at their level, so that we can all understand each other and create a partnership that ensure that avoidable harm is prevented, is critical. So I give thumbs up to the organizers of this conference. It's come too late. I think it should have been much, much earlier, so that the patient voices in Africa is heard at all levels. But better late than never. And I hope that going forward, we are going to have significant involvement of patient groupings in Africa in how healthcare is planned and delivered. I would end here and say thank you, and hoping that I have made judicious use of the time. Thank you.
Thank you, Dr. Titus, for your elaborate presentation. You have raised the important issues which are required to be embraced by all the relevant stakeholders in the health sector. You have talked of taking into account unique groups whenever we have pandemics. You have raised the issue of the maternity settings. You've also raised another issue of involving patient groups in all these pandemics, as well as in the planning of emergencies. This is the cry of IAPO, and this is the cry in Africa. So we hope this Congress will present a new chapter to those that are required to involve patients in whatever they are doing. At this juncture, we open the floor for questions and answers, if there are any, because on my screen, on the chat, I haven't seen any question from the participants. Maybe I should start to Dr. Gertrude. You in most cases, the implementation of the strategies which you have presented hinge on the national governments, the Ministry of Health and their facilities. What monitoring or policing measures are there to ensure that the ministries of health in Africa do indeed get involved in patient engagement? Because this has been lacking in most of the national government. Thank you.
Okay, thank you very much. Can I respond?
Yes, yes.
Yes, thank you very much for the question. You are very right, and especially with WHO, we actually work with governments for the implementation of the strategies and interventions that we suggest, because they are actually in the lead, and they are leading the country. So their voice is what WHO will really listen to. Importantly, I would like to indicate that to monitor the implementation of this action plan, the document also outlines some key indicators that for the next 2 to 3 years, up to the 10 years, we'll be monitoring. And it includes aspects on how the government is going to actually involve patients and then advocates in the implementation of patient safety. So when you look at strategic number 4, as I indicated, there are a number of action points that have been outlined in the global document that encourages governments to actively involve patients and families at the policy level, at the service delivery level, and even in the community to get their voice, listen to their needs and expectations, and then improve the service. So to be a co-developer of policies and programs, you have to be on the table. And we have indicators that will be looking at that. Even in the translation of this action plan at the national level, we will be guiding countries to come up with specific indicators related to how this is happening in their countries. So definitely we'll also be advocating for this patient safety, for patient safety networks. And then I'm happy that there is now a global system of collecting patients' view from IAPO that we can more or less collaborate with to, at the global level, also get the voice of patients and advocates in patient safety. So WHO will be doing their bits at the strategic and technical level. National level will also be doing their bit. And importantly, we all need to be the eye of how patients, families, and advocates are involved in the process. I hope I've given some guidance. Thank you.
Thank you very much, Ellos, your response to this. Thank you. Ellos, you've gone on mute.
Yes. Hello.
Yeah, yes, a question for Dr. Titus, please. Dr. Titus, I'm picking up a question from our end here. Could you please give us an opportunity as to what should we recommend this World Patient Safety Day? What are the 3 important things that we should recommend to every health facility who comes into touch with the family planning, right from the conception right down to delivery and postnatal care? What are the three things we should be doing to improve safety in Africa on maternal and newborn healthcare? Thank you.
Thank you. Can I respond?
Yes, Dr. Titus, you have the floor.
Okay. Thank you very much. So I think the first recommendation will be that we have participation of patients in the planning of the services, so that the services is tailored to the needs of the patients. The second is that the lesson that we are learning from this pandemic is that under pandemic situations or emergencies or even epidemics, we should plan ahead and be mindful of vulnerable populations like the pregnant women, like children, and make sure that their needs are catered for. For instance, currently, when we started vaccination, most of the vaccines have not been proved safe for pregnancy yet. And these people yet are vulnerable. They'll go to the antenatal clinics and their risk of contracting this condition is there without any vaccination. So how is our communication and planning done to cater for the needs of such a special group of people? My final recommendation will be that if you look at safe maternal care, it's multi-sectorial. We have the role to be played by regulatory authorities that will make sure that the practitioners are qualified, licensed to provide the care. Regulatory authorities that make sure that we get genuine, safe medicines, only registered medications available in the health facility for the healthcare practitioners to use. Then we have other sectors like roads that makes the health center accessible to the people, communication system or sector to allow us to reach out to the people. So all these sectors must have central in their planning the care for maternity services. And if that is done, I think we can get improvement. So if patient organizations are called in, I think they should be looking at how to improve the multi-sectorial bit. I will just end by saying, for instance, in Ghana here, our FDA over the years has demonstrated a lot of efficacy in their work that has boosted confidence in the practitioners that if you have a drug licensed by the FDA is good. But we have a problem with procurement systems where you would have drugs that are entering into our pharmacy that we don't know where they are coming from. And sometimes they are not drugs licensed by the FDA. Then how do we solve such a situation? So I think this multi-sectorial bit is important. And this is what I think the patient advocates should be looking at. Thank you.
Thank you.
Can I add just one point to that?
Okay, welcome.
Yes, and especially for this year's Patient Safety Day celebration, we want member states to also highlight the importance of respectful care. We are quite aware that we've had a lot of challenges regarding attitudes and some practices in healthcare facilities regarding pregnant women and deliveries. So as part of the celebration, we are encouraging member states to use their local data and then the experiences to highlight, bring to the fore the need for respectful care for mothers and children as well, aside the issues of the standards of care that they need to promote. Thank you very much.
Yes, this is an important element whereby the member states should be involved in the commemoration, because in most cases we find that member states leave it to patient organizations or civil society. They don't really take part in celebrations like this. So We hope this year member states will take the leading role. Thank you. Kawadip, do we have any?
No, thank you very much. That is very well done. Manish, I will now wrap up this session. Thank you, Ellos. Thank you, everybody. Thank you, Dr. Gertrude, and also thank you very much, Titus. You've done a great job. My simple message is let us join up on the 17th September and make sure we have a great World Patient Safety Day and ensure that we have followed all the campaign. Please join us with WHO if you search for that. There's a lot of campaign material. Please do run activities safely though. Please do observe protocols. And please do insist, write a letter to your ministers, etc. One of the things we all want to see is that every monument in Africa that is of significance to us to be lit up in orange. We have got some excellent monuments that have marked our passage through history when we were independent. We've got monuments that have marked some very great transition by way of when certain things were brought about. And these historical monuments must be lit up orange. Please join us then. And I would just say that now please join your families if you're marking Eid al-Adha. Have your lunch. We'll be coming back at 1300 GMT, which is another about 45 minutes or so. Please do take care of yourself, and we'll see you then. And thank you all the presentations. It was a great day. Thank you.